Hello everyone. Welcome to Aging is for Everyone. No, your eyes are not deceiving you. I'm Rosemary Hall, and I'm sitting in for your regular host, Laura Mondello. Today our program is going to be, the theme is the changing face of the elderly. And over the last few years, 2 years I believe, the Department of Senior Services, Erie County, has been conducting surveys and studies to see how the population, the older population in Erie County is changing. And with us today, we're very fortunate to have Randy Hoak, who is our new commissioner of the Senior Services. Randy recently just accepted the appointment. Welcome, Randy.
Thank you, Rosemary.
Nice to have you. Thank you for giving us your time. We know you're busy. But in light of that theme of the changing face of aging, tell us about this study and this survey that the department has been doing.
Sure. Our needs assessment is actually a part of the 4-year planning cycle that is required by the Older Americans Act. And what we've done, we know that there's a lot of work going on in the community. There's a lot of information that's already out there. So we started with some of the information that the U.S. Census Bureau has gathered. That provided us with a lot of our data. But we didn't stop there, of course. We gathered 1,000 surveys of our own, and we spent a lot of time conducting focus groups. And for this assessment, we looked at some rural groups, some inner city groups, some hard-to-serve populations. That might be the homeless or the LGBT population, mental health population as well, caregivers, Hispanics, and our advisory board, our Senior Services Advisory Board. We also held some discussions with some key informants. These might be community leaders or many of our service providers that we have agreements with. As far as our key findings, some of the things is information that we already know. Some of the things is information that's been readily apparent since the previous census in 2000. Our aging population, our older adult population, is growing. Currently, 1 in 5 older adult, 1 of 5 are over the age of 60. 1 of 5 individuals are over the age of 60. People are living longer. We have more super seniors, if you will, that are 85 and up, and even the centenarians are experiencing a great deal of growth as well. The older adult population, in addition to being greater in number, is also much more racially diverse. We have fewer seniors that are living in the city of Buffalo and more in the suburbs, with a great deal of growth of the older adult population in the outer ring suburbs, places like Grand Island, Sardinia, and Clarence. So, and those more rural areas, of course, are traditionally harder to serve as well. So
transportation too.
Absolutely. Absolutely. Transportation is a challenge for our department and for our communities. Aside from the need for transportation, the needs assessment pointed to some other persistent problems as well. A growing number of older adults are having trouble taking care of their homes, cleaning the inside of their homes, maintaining the outside, making small repairs to their homes. They're also having trouble with their finances, including paying for out-of-pocket medical costs, other expenses.
Everything else goes up too.
Yep, absolutely. Food is also another problem with the price, especially recently in groceries going up. We've seen an increase in food needs. Not surprisingly, these problems are amplified by folks who may be on a fixed income. So those are some of the significant findings of the work that we started in 2011.
Was anything really surprising to you, Randy?
Well, there were a few. Most of it, no, was not surprising. But there were some things that came out of it that, as a department, as a community, we need to take a hard look at, especially when it comes to some of those harder to serve populations. An interesting example is within the Hispanic community. We found that there was no adequate translation for respite which is something that we focus on at the department. Caregiver issues, caregiver programs, providing respite. But the cultural difference was that the language didn't have a word that adequately reflected what we were talking about, and the culture really takes ownership of providing care for their elderly, and some attempts to assist in those areas were viewed as trying to take a responsibility that belongs with
interfering rather than helping.
Absolutely. We also took a look at health and wellness, exercise. And what we found is that many of our older adults, especially those between 60 and 75, are reporting problems getting enough exercise. The 75 and plus population don't report that trouble, or perhaps don't acknowledge that trouble, or maybe aren't that concerned with that. But the 60 to 75 see that as a difficulty.
That the service, that there's not enough opportunities for them, or that they have a hard time getting to the places where the exercise classes and wellness classes are taking place, that they can't get there? What do they mean that they...
It's likely both. It's something that the department needs to examine further, but it's likely a matter of getting to the activities or finding activities that meet their schedule. Because let's face it, a lot of folks in that age group are perhaps working longer than they had anticipated.
I can understand that, because all the classes, I mean, I work, and all the classes that we're talking about are early in the day, like in the morning. There's nothing later than 2:30 in the afternoon, so I can see how that would be a problem. And yet people are working longer.
So another key trend is we found that folks are reporting problems with their emotional well-being. Folks that might be feeling lonely, isolated, or depressed. And this is another area where more of the younger seniors are reporting problems. 40% of that 60 to 75 age range, as opposed to 33% of the older seniors.
Wow. You got some really interesting information. It's going to be interesting to see how the department is going to gear their services to meet those needs. It's going to be very interesting, but I know you can do it.
We have some challenges ahead for sure.
Well, challenge keeps you on your toes, right? And I know that the department has never. Really can't say that the population can ever say that that the department wants for trying. There's always out there trying. So, very interesting. Is there anything else that you wanted to add now? I know we're going to bring you back for the third segment. Going to be talking about what all this information is what we're going to do with all that information. Anything else that you want to add to it?
No, just that the department takes an approach of looking at all these issues, and we realize that working with our community partners, we can meet these challenges.
As one of the major funders, we all look forward to it. All right. Thank you, Randy, so much for giving your time today to be with us, and we'll see you in the next segment.
Thank you, Rosemary.